going from one position to the other. So I'm going to start out with a really strong hip hinge, folding from the hip, tipping the pelvis forward, right there. Nice straight spine. And then I'm going to start to curl and feel how that changes the shape of the spine and where I feel the effort. Give a little wall hang. And of course, when we do the half forward fold, when we're trying to get students to create that straight line through the spine, and sticking the pelvis back, lengthening the low back, a lot of times what you'll get is this. This is a way to start to help them to feel how to control that movement from the hip joint, how to fold from the hip joint, and then keeping a long line through the spine. Or when you want to stretch the back and lengthen the lower back muscles, then going into spine flexion. But in that half lifted pose, we can start to do some interesting variations with the arms, and that's going to change how much effort you're feeling in the back muscles for sure. The farther the arms go out, it's going to create more effort through the back muscles. I can really feel those back muscles working. You can throw in some wall angels. And then back up. When we're working on rolling through the spine, articulation of the spine, it's such a great way to work on control and connection to specific segments. And I like to practice this at the wall because it gives you such a great reference point of starting position and then peeling away from the top of the spine. I think about the joint right at the base of the skull. I start to tip the head forward from there, and that's where my roll down begins. Shoulders start to go forward. I'm going to see if I can get all the muscles or all the vertebrae in the back to touch the wall before I peel them away. And then somewhere along that point right there, my pelvis starts to follow. And then let the body go all the way down. Now on the way back up, you're feeling the effort of the back muscles that have to bring the body back up into that shape against gravity. Pelvis comes up, and then everything starts to stack on top of the pelvis, trying to get the shoulders back and then placing the head right over the top of the shoulders. Trying that at a really slow pace, because the slower you're going gives your brain more time to communicate with the abdominal muscles and the back muscles that control the forward and back movement, so that you can get each vertebrae really specifically, each segment of the spine. If you find that one particular area is harder to control than the others, which is totally normal, all of us do, especially when you're doing this sitting on the mat and you're trying to roll down onto your back, what you want to do is go extra slow through that range of movement. So for me, it's when I pass from kind of the mid-thoracic to the lower thoracic, and I have to get those ribs back, and then I transition into the lumbar spine. I find it difficult to control right through there. So I'm going to do a few movements. You can feel the abdominal muscles are a little bit weaker there, which is one of the reasons why I'm having more difficulty with that part of the roll down. But this feels like it's targeting them really nicely. And then I'll come back up. So you can isolate a little area, roll down, roll back up, so that you can create more control in that space where you didn't have as much connection, and then integrate that into the full roll up and roll down.